Are you ready to dive into a thought-provoking exploration of sexual orientation and gender identity? Buckle up as we embark on a captivating journey, navigating the complex landscape of human sexuality. In this eye-opening discussion, we'll unravel the intricacies of LGBTQ+ identities, unraveling the mysteries surrounding sexual orientations and gender expressions. Get ready to challenge societal norms, broaden your understanding, and embark on a path of self-discovery. Whether you're questioning your own identity or seeking a deeper understanding of the diverse LGBTQ+ community, this insightful video will leave you enlightened and empowered. First, let's define what sexual orientation is all about. Sexual orientation refers to a person's enduring pattern of emotional, romantic, and/or sexual attractions to individuals of a specific gender or genders. The LGBTQ+ community encompasses a range of sexual orientations. Here are recognized sexual orientations within the LGBTQ+ spectrum. Lesbian is biologically a woman who can act, speak and dress like a typical man or a typical woman but who is emotionally, romantically, and/or sexually attracted to other women. Gay is a term often used to describe men who are emotionally, romantically, and/or sexually attracted to other men. However, it can also be used as an umbrella term for individuals of any gender who are attracted to the same gender. Bisexual is an individual who is emotionally, romantically, and/or sexually attracted to people of both their own gender and other genders. Bisexuality can encompass attractions to more than two genders. Pansexual is someone who is emotionally, romantically, and/or sexually attracted to people regardless of their gender identity or biological sex. Pansexuality can be described as attraction to all genders or attraction regardless of gender. Queer is an umbrella term used by some individuals to describe their non-heterosexual and/or non-cisgender identity. Queer can be an identity in itself or a term reclaimed by some LGBTQ+ individuals. Asexual is a person who experiences little to no sexual attraction to others. Asexuality exists on a spectrum, and individuals may have different levels of romantic and emotional attraction. Aromantic is someone who experiences little to no romantic attraction to others. Aromantic individuals may or may not experience sexual attraction. Demisexual is a person who experiences sexual attraction only after forming a deep emotional or romantic connection with someone. Androgynosexual or androgynophile is an individual who is attracted to androgyny or a blend of masculine and feminine characteristics, regardless of the person's gender identity. Polysexual is an individual who is attracted to multiple genders but not necessarily all genders. It can be seen as an attraction to multiple but not necessarily all genders. Omnisexual encompasses attraction to people of all genders. However, some individuals who identify as omnisexual may acknowledge and experience gender as a factor in their attraction, whereas pansexuality emphasizes being attracted to people regardless of gender. Scoliosexual is an attraction to individuals who are transgender, non-binary, or genderqueer. It is an orientation that is specifically inclusive of gender non-conforming individuals. Graysexual falls within the asexual spectrum and refers to individuals who experience sexual attraction infrequently, only under certain circumstances, or with a very low intensity. Questioning refers to individuals who are exploring or questioning their sexual orientation. They may be uncertain about their attractions or may not have yet found a label that fits their experiences. Two-spirit are individuals who embody both masculine and feminine qualities or have a non-binary gender identity. Androgynosexual. Androgynoromantic. This term describes individuals who are specifically attracted to androgynous or gender-fluid individuals, regardless of their own sexual orientation or gender identity. Transsexual or transgenders are individuals whose gender identity does not align with the sex assigned to them at birth. Transsexual individuals may undergo medical interventions such as hormone therapy or gender-affirming surgeries to align their physical characteristics with their gender identity. It emphasizes the physical and medical aspects of transitioning. Transvestite are individuals who derive pleasure or satisfaction from dressing in clothing typically associated with a different gender. Transvestism is considered a form of cross-dressing, where individuals may wear clothing traditionally associated with the opposite gender for various reasons, such as self-expression, personal enjoyment, or exploring different aspects of their identity. It's important to note that sexual orientation can be fluid and may evolve over time for some individuals. Additionally, different cultures and communities may have their own unique terms and identities that are not listed here. Ultimately, it is crucial to respect and use the terminology preferred by individuals when discussing their gender identity. It's always best to listen to and defer to how someone identifies themselves. Exploring one's sexual identity and navigating questions of orientation and gender can be a deeply personal and individual journey. It involves understanding and accepting oneself, exploring different aspects of identity, and finding a sense of belonging and authenticity. While I can provide some general guidance, it's important to remember that everyone's experiences are unique, and seeking support from qualified professionals and communities can be helpful. Self-reflection. Start by engaging in self-reflection to better understand your feelings, desires, and experiences. Ask yourself questions about who you are attracted to, what genders you feel comfortable identifying with, and how you relate to your own body and gender expression. Educate yourself. Learn about different sexual orientations and gender identities. Understanding the diverse range of identities can help you explore possibilities and find the labels that resonate with you. Read books, articles, and personal stories, and engage with online resources and communities. Seek support. Connect with supportive individuals or communities who can provide guidance and a safe space to explore your questions. LGBTQ+ organizations, online forums, and local support groups can offer valuable support and insight. Consider reaching out to counselors, therapists, or mentors who specialize in LGBTQ+ issues. Explore your feelings. Experiment with your feelings and attractions in a safe and consensual manner. This may involve exploring relationships, talking to people with similar experiences, or seeking out resources such as online forums or LGBTQ+ friendly social events. Give yourself time. Remember that self-discovery is a process, and it's okay to take your time. It's common for individuals to have evolving understandings of their sexual orientation and gender identity over time. Embrace self-acceptance and allow yourself to grow and explore without feeling rushed or pressured. Challenge societal norms. Recognize that societal expectations and norms can impact our understanding of sexual orientation and gender identity. It's important to question and challenge these norms to discover your authentic self. Surround yourself with accepting and inclusive influences that celebrate diversity. Professional guidance. If you find yourself struggling with your sexual identity or experiencing distress, consider seeking support from professionals who specialize in LGBTQ+ issues, such as therapists, counselors, or psychologists. They can offer guidance, validation, and strategies to navigate your journey. Remember, your sexual orientation and gender identity are personal and valid. Embrace self-acceptance, be patient with yourself, and surround yourself with supportive individuals who respect and celebrate your identity. Moreover, when discussing psychological aspects of your sexuality with others, it's important to approach the topic with high sensitivity. Note that some seemingly sexual orientation is actually a psychological disorder. Here are psychological disorders or conditions related to sexuality that are recognized in the field of psychology and psychiatry. Paraphilic disorders. Paraphilic disorders refer to patterns of sexual arousal and behavior that involve intense and persistent sexual interests or fantasies involving atypical objects, activities, or situations. Examples include exhibitionism, voyeurism, fetishism, sadism, masochism, and pedophilic disorder. It's important to note that engaging in these interests consensually and without causing harm to oneself or others is not considered a disorder. Sexual dysfunction. Sexual dysfunction refers to difficulties in sexual functioning that cause distress or problems in a person's sexual life. It may include conditions such as erectile dysfunction, premature ejaculation, female sexual interest, arousal disorder, orgasmic disorders, or genitopelvic pain, penetration disorder. These conditions can have various psychological, physiological, or relational factors contributing to them. Gender dysphoria. Gender dysphoria is not a disorder related to sexual preferences but rather to gender identity. It involves a deep distress or discomfort experienced by individuals whose gender identity differs from the sex assigned to them at birth. This distress may lead to seeking gender-affirming treatments such as hormone therapy or gender reassignment surgery. Hypersexuality. Hypersexuality, also known as compulsive sexual behavior or sexual addiction, involves excessive sexual thoughts, fantasies, or behaviors that may interfere with a person's daily life, relationships, or well-being. It can be associated with underlying psychological factors or addictive patterns. Hypoactive sexual desire disorder. Hypoactive sexual desire disorder, HSDD, refers to a persistent or recurrent lack or absence of sexual interest or desire, causing distress or difficulties in intimate relationships. It is characterized by a significant decrease in sexual thoughts, fantasies, or desire for sexual activity. Exhibitionistic disorder. Exhibitionistic disorder involves a recurrent and intense sexual interest or arousal from exposing one's genitals to unsuspecting individuals. It typically causes distress and can be considered a form of paraphilia. Voyeuristic disorder. Voyeuristic disorder is characterized by a persistent and intense sexual interest or arousal from observing others engaging in sexual activity or naked individuals without their consent. It can cause distress and is considered a paraphilic disorder. Fretteuristic disorder. Fretteuristic disorder involves recurrent and intense sexual urges or fantasies that involve touching or rubbing against non-consenting individuals in crowded places. It is also considered a paraphilic disorder. Pedophilic disorder. Pedophilic disorder refers to a persistent sexual interest or attraction toward prepubescent children. It is important to note that the attraction to children is considered a disorder, and acting on these attractions is illegal and harmful. Sexually transmitted infections, STIs. While not a psychological disorder, it is worth mentioning that some individuals may experience distress related to sexually transmitted infections, STIs, or concerns about sexual health. Seeking appropriate medical care, practicing safe sex, and addressing emotional and psychological well-being are crucial in managing STIs. It's essential to approach these topics with empathy and understanding, as individuals may experience these conditions in different ways. If you or someone you know is experiencing distress related to sexuality or sexual behavior, it is recommended to seek professional help from qualified mental health professionals such as psychologists or therapists who specialize in sexual health or sex therapy. They can provide appropriate assessment, diagnosis, guidance, and therapeutic support tailored to individual needs and circumstances.